My name is Dr. Michael Bigham. I'm a pediatric ICU physician, I'm a parent, and I'm the Chief Quality Officer. The new vaccine schedule just recently announced by the CDC essentially makes the same number of vaccines available that have always been available, and that number is 17, except it significantly reduces the number of recommended vaccines. That number that used to be 17 recommended vaccines is now reduced to 11 recommended vaccines. Those other 6 vaccines are now recommended only for high-risk patients. And for those patients that are normal risk or standard risk patients, those vaccines are just recommended to be part of a conversation and a shared decision between the patient and the family and the healthcare provider. For those parents who are worried about whether or not the vaccines are still going to be available to their child in the future, I think we can at this point still be pretty reassured. What we understand to be true is that Medicaid and private insurances are all still going to cover the cost of those vaccines, even those that are now no longer recommended. That's reassuring. So families aren't going to be forced to make a decision between a vaccine and other expenses that their family has. Similarly, offices are going to still have vaccines, even those that are no longer recommended by the CDC, will still have those available at all of your pediatric offices. What we hope to be true is that you and your provider will have an important conversation about the value of that vaccine and the care of your child, and hopefully come to the decision that that vaccine is probably still indicated for your child, at which point we'll provide the vaccine. I think what's important to remember is that for decades we've been having conversations between healthcare providers and patients and families about the science behind vaccines and the importance of those vaccines. And we don't think that's going to change. If those conversations are helpful to get families comfortable with the science behind those vaccines, we will continue to have those. Fortunately, despite the changes in the recommendations around vaccines, we do expect, and even the federal government has announced that vaccines will still be covered by insurances in the same way that they always have been. So there'll be no expenses that the families will have to incur in order to make the decision to provide a vaccine for their child. For those non-essential vaccines that are now only recommended for high-risk patient populations, that doesn't mean that lower risk or standard risk children are unable to get those vaccines. Those will still be available, and there'll be no requirements to demonstrate any need or risk for those lower risk or standard risk children. The only change is that the CDC now recommends that there's a conversation between the healthcare provider and the patient and family around those vaccines that are no longer recommended. As a medical professional, and quite honestly on behalf of the pediatric profession, we're a little bit concerned and confused about these new CDC recommendations. At our heart and soul, we're scientists, many of us are parents, and we worry a little bit about the confusion that families might be facing related to these new vaccine recommendations from the CDC, particularly because these vaccine recommendations differ from the American Academy of Pediatrics or the AAP's recommendations around vaccines. I think we can be assured that at Akron Children's and at your pediatrician's office, we want to help you navigate that confusion, and we'll be very open and honest about our understanding of the science and the potential benefit and absolute safety around the vaccines that are now no longer recommended. So the schedule for vaccines is recommended through the American Academy of Pediatrics, and those are sometimes changed. Sometimes we go from 1 vaccine to 2, sometimes we go from 2 vaccines to 1. But what we know about the vaccine schedule is it is designed to maximize the body's response to the vaccine and thus the prevention of future illness. We know that families sometimes choose to time their vaccines differently, and I would encourage those families to have a conversation with their pediatrician. What we want is your child to be safe and protected. And so if that can happen only through your decision to space the vaccines a little bit differently, I think most of our pediatricians would accommodate that. I think there's one important piece to understand when families are making that decision. There's actually fairly strong evidence that when families go what we call off schedule or start to create their own custom schedule around vaccines, there is pretty strong evidence that would suggest that those families end up not getting their full vaccination schedule by the end of their child's childhood. And so I think that's just an important risk for families to understand as they're contemplating whether or not to modify the standard schedule for vaccines or whether to stick with the recommended schedule. The timeline for the new vaccine schedule to go into effect is a little bit unclear, but I think from the standpoint of a parent or a patient and that next visit at your pediatrician's, it should look no different. We'll still have those vaccines available, those that remain recommended and those that are now recommended only for high-risk patients. And most importantly, your pediatrician and healthcare provider are still going to want to have conversations about those vaccines as it relates to your child and your child's health. That will be unchanged. I think the most important thing for parents to know around this new CDC vaccine schedule recommendation is that your Akron Children's provider and pediatricians across the United States just want what's best for your child's health and safety. In the end, if we're unable to help you be comfortable with a specific decision, whether it be around an antibiotic or a vaccine, it's our job to help come to comfort with that. You should be informed. You should be a strong advocate for your child, just as we're a strong advocate for your child. Together, the child, you as a parent, and us as your healthcare provider should be able to have one common goal, and that's the very best health and outcome for your child.